alaikum wa rahmatullahi ta'ala wa barakatuhu. I am by name Nura Zubairu as usual, and today we are going to discuss on occupational health and safety. If I could remember, before we go for the break, we were able to cover the curriculum. So today is going to be a revision class, and we are going to do it very snappy. I think I have just prepared from 1 to 10 slides, so you go through it, and if you have any question, you have to forward your observations to me. So now, before we go deep into our discussion, I think it is of paramount important for us to remember some 4 important key technical terms in this course. Occupational health and safety. We have occupation, we have health, we have safety, we have occupational health. These 4 terms is good for us to know them. What is occupation? Occupation simply means any work that someone has engaged to earn a living is what we call occupation. Any type of work you have engaged to earn a living, and people engage in different work they do. No one can survive without having a particular work to be done, and each work is associated with different type of hazard and risk. So now, what is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, it's a state of complete physical, mental, and social well-being, not merely the absence of disease or what? Infirmity. That is by World Health Organization. But you can define health as absence of disease or freedom from illness, or a complete soundness of body and mind, free from illness, pains, and disease is what we call health. Then what is safety? Safety is a state of being certain that adverse effect will not be caused by some agent under defined conditions. The more you are paying attention to the safety rules, the more you are living in a safest condition. So now, taking any step to ensure that risks or predisposing factors or hazard will not endanger our health, well-being, and survival is called safety. Then we have occupational health and safety. Occupational health and safety is defined by many scholars and different textbooks and even public health organizations. You can take a look at this number A definition of occupational health. We said, according to this definition, occupational health simply refers to the creation of a state of physical and mental well-being within the occupational environment while taking into consideration factors relating to the social and domestic life of individual. What I want you to understand in this definition of occupational health is, number 1, we want to make sure that we create state of both physical, mental, and social well-being of the worker we have employed, or the worker someone has employed. Number 2, we want to consider some factors relating to this social and domestic life of individual you have employed, because if the worker is having any issue in his domestic homes, they can take this problem at home and take it to the working environment, where it can affect his health and well-being. For example, maybe a worker is having issue at home, his family are hungry and they didn't take anything, and do you think the worker will have rest of mind? Of course no. So now, when he come to his working environment, he will be thinking of his family because they are they are in hunger. So now, that thinking of his family will not allow him to pay more attention in his work, which at the end of the day, it may lead him to a particular risk For example, he might be working with a kind of sharp machine or a sharp instrument or pointed equipment. Accidentally, he might get injured because his mind might not be there. So that is why we have to consider the social and domestic life of that individual you have employed. If you go to second definition of occupational health, that is definition B, we said is the provision of public health care for all people gainfully employed. What is public health care? Any kind of health care to the what? To the person is public health care, right from the preventive services to the curative services to the rehabilitative services and even welfare services are all part of the public health care to for every person that is what gainfully employed. If you have employed the person, that means you have to make sure you provide all public health care to him. We said it takes into account the study of all factors influencing the health of workers at their places of work as well as at home. I want you to also understand this. We said what? In the at their places of work as well as at home. Kada ka ce, don't say it is only the you have you will only consider the person working in an occupational environment or in the place of work. If that person has any problem at home, that problem will also be taken to the place of work. That is why we have to consider the factors influencing the health of the worker at their what places of work as well at home, and solve these issues so that it will not be escalated. So according to joint committee between ILO, that is International Labour Organization, and WHO, World Health Organization, we call them expert committee. In their 1959, they have made some kind of observation that are up to 112. So now, this in these recommendations they have made, they also define occupational health as the word promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. Occupational health is aimed at promotion of the word physical, mental, and social well-being of all workers in all occupations. After you have promoted this health condition, you are also expected to maintain. We want to maintain the highest degree of physical, mental, and social well-being of workers in all occupations. If you have done that, that means you have practiced what we call occupational health and safety. So now, since we have known the definition of terms, we have know what is occupation, we know what is health, we know what is safety, and we know what is occupational health. What is the purpose of bringing occupational health? Workers are exposed to various hazards in their various places of work. This hazard can predispose them to different injuries, accident, illness, disabilities, or even death to some extent. And we want to ameliorate the what condition. We don't want the condition to continue occurring. We want to change the condition to the what? To the most important or most suitable one. So that is why we bring occupational health and safety to the curriculum of community health workers, and more especially environmental health extension workers, for us to ameliorate the situation. So now that is why we are asked to train you on occupational health and safety, so that at the end of the day you should be able to learn various aspects of occupational health and how to ensure safety at various places of work to all the workers that are gainfully employed in these various places of work. So, what are the aims and objectives of occupational health? There are some aims and objectives of occupational health. You can even think of as many as you can why do we, or what do we want to achieve in occupational health and safety. But there are 5 aims and objectives of occupational health and safety, according to World Health Organization slash International Labour Organization, together called Expert Committee, as they have proposed in their 259. Number one, they said one of the aim of occupational health and safety is to promote and maintain the highest degree of physical, mental, and social well-being of workers in all occupation. Okay, we want to promote and we want to what, maintain the highest degree of both physical, mental, and social well-being of workers in all occupations. That these employees are what, engaged or involved. So now, secondly, we said the prevention among workers of departures from health caused by working condition. We want to prevent the departure of health of the what, workers, as a result of their working condition, because workers are having different types of ill health condition as a result of their working condition. So occupational health is aimed to prevent this departure of health of what, by the workers, as a result of their working condition.